Like I mentioned in my email, you were one of our finalists. We got over 1,600 phenomenal people who were excited about this, and yours definitely stood out. It was me and 4 or 5 other colleagues that were reviewing the applications, and all of your answers were just so articulated. We were really motivated by your volunteer experience with women, and I think what really drew us is your drive toward your career and helping in rural and underserved communities.
Mm-hmm.
I think that's such an important thing for nurses to be into, and you clearly have a pulse on the issues and a drive toward helping others, and that was just awesome.
Well, thank you so much.
So congratulations on being a finalist, but also this call is especially exciting today because you're not just a finalist, you are our chosen winner for our 25 scholars.
Oh my gosh, that's amazing.
Yes.
Wow, that's an amazing surprise. Thank you.
We are so excited for you to go continue your education and make your career goals happen. We were hoping that you could give us a brief kind of synopsis of some of those things that you shared in your application and start and tell us what inspired you to go down your career path.
Let's see. So I've been working in mental health for about 8 years. So I went to school and became a clinical mental health therapist. So I got my LPC license and was doing that work often. Like I did several different facets. I was working with male sex offenders and crisis intervention, but mostly in dual diagnosis, so like substance abuse and mental health. A lot of that was with different populations, women who had lost their children, etc. A problem I just kept running into was I would have these clients, these patients that really needed to see a specialist. Like they were really struggling with depression, and it was this insurmountable barrier. Like if you can't get out of bed, you can't really make it to your appointment. And if you can't get out of bed, you can't like get the job that you need. You can't meet with the people who referred you. Like if you can't make it to see your caseworker, how are you going to get to see your kids? I just kept running into this problem over and over again where there was this absolute, just a desert pretty much of people who would accept Medicaid. And the providers that seemed to work the best with my patients were people like nurse practitioners or RNs. And I got to really work with them a lot more and found out that we just have a real lack of people that are able to accept state insurance. And so we were heavily relying on primary care doctors who would call me and say, this is not my area of specialty, I don't know what to do. And so finally I'm like, if this is my passion and this is where I see a need, then I really need to just, pretty much change my life path. Yeah. And go to nursing school. And then I'm in the psych DNP program too. So, that's kind of how that all led. It's always been my passion to work with people who are really marginalized and underserved, because I feel like when we get the chance to really listen to someone's story, we find out that they are not different from us. People that end up oftentimes addicted or, have severe mental health problems, they have stories much like all of ours. They have families, they have, lives before we meet them. So I think, that's how it really led me to wanting to work in like rural communities and, with people that are just essentially underserved. Like right now, my population rotation is I'm working in Old Town Portland. So people that are houseless or have mental health and substance use problems. So it's like, I really love the fact that my particular nursing program has like a 3-month rotation doing that, because I feel like that's really where nurses shine. Is we are the connection between the medical community and these patients. And oftentimes, I just have had really good experiences with nurses who take the time to listen. So I want to be one of those people.
Absolutely. That's wonderful. You mentioned like your program, and that sounds awesome that they're offering that rotation. Is that what drew you to that program specifically, or what other factors did you consider? Because you're at OHSU, right?
Yeah, Oregon Health Science University,
okay.
OHSU. So it's in Portland, Oregon. It's like one of the few state-run places that you can go. So there's really a lot of just private nursing programs, because I already had a degree, so I wanted to do the accelerated program, because I'm not a spring chicken anymore. And I'm asking a lot of my family to say, like, okay, once again, I'm called to go do something and I have to like go back to school. So I'm trying to be respectful of their time too. But yeah, I love the fact that OHSU really focuses on, they never really turn anyone away. When I was doing rotations in the hospital, a lot of the patients there are people that either they didn't even have insurance when they came in, or they were flown from different areas of Oregon that are so rural that they don't have the opportunity to have the kind of medical care they needed. They have an office of rural health at OHSU, and so that's one of my huge passions. So when I found out that they actually have a dedicated area of the university for that, that was a big deal for me. And they have like a variety of classes within my program that I can take to really learn more about how I can serve in those communities, because I've done some rural work, but not really to the extent that I feel like I want to continue being more educated about that so I can serve. So I don't just come into someone else's community, someone else's home and say, I know how I can serve you. I want to learn I want to ask the patient. I want to learn first before I just sweep in and try to do something. So yeah, that was a big deal for me.
They're lucky to have you. How much longer do you have in your program?
I have 2 more semesters before I can do the NCLEX in September of 2020, and then I will go straight in the doctoral program for 3 years after that.
Planning on staying in Portland afterward?
I'm hoping that after I graduate with my DNP that I can possibly work somewhere, like maybe in Oregon, but maybe somewhere else that's very rural. And because I have a credential in drug and alcohol counseling, and then I also have my mental health credential, so I'm hoping to work somewhere that doesn't have providers, that like they really need someone who is maybe dually certified as a nurse as well as a mental health provider, or vice versa. So that's kind of where I'm looking is through like HRSA and whatnot.
That's fantastic. I'm so excited for you, and like I said, thank you so much for applying and sharing your story with us. Good luck in everything you do and continuing to make a difference in your field and for those that you're serving. It's all really awesome.
Absolutely. Thank you so much for this opportunity.
Thank you.
I really appreciate it.
And congratulations again.